Welcome. I am pretty much going to be going over a few things briefly. Also doing a health check on everybody who has been following me. My name is Dr. Mkono, and I am just trying to make sure that we don't leave anybody behind with the basics. Asthma, COPD. Maybe you're getting evaluated for asthma or COPD and you're not quite diagnosed with asthma or with COPD, and you do not know how to approach your illness, how to give yourself an advantage, then this video or this live is for you. If you don't have questions, it's okay, but I know that I have a following now, and I'm very happy that I am building a following of people who are seeking this sort of information in a more interactive way. Your providers are doing their best. In a visit, it's hard to kind of jam in everything. Most of you are probably going to pick up these tips in a series of visits. I think it's important that you cross-check everything I say with your providers, because that's why they know you, and they are working with you and they know you best. I think I had a very interesting comment on someone who said, oh, the trilogy is causing them, trilogy is an inhaler, depending on where you guys are, is causing them to retain fluid. And I said, wow, I prescribe it quite a bit. I have never seen that. But hey, I'm not here to advise this particular person. I'm just going to say, please seek care, because when you are wheezing, when you're short of breath, when you can't catch your breath, when you are diagnosed over and over with breathing disorders, it does not mean just because you were diagnosed last month with asthma, there will be asthma for the rest of your life. We have to be smart, which is why I'm here. If we're not smart about any illness or issues that we may have, we don't do the best in caring for ourselves. So the more you know, the better you can maneuver asthma and COPD. And I make it very simple because it is simple for majority of you. And anybody else who finds it too simple, that makes sense, but just cross-check that you're doing these simple things. A lot of the times they're dismissed. You don't have an advantage of really taking care of your asthma fully because you didn't realize that these inhalers only work if you are consistent with them, especially the maintenance inhalers. And so whenever I do a video and I'm educating, I'm always hinting, because as a pulmonologist, as of today, when I see patients today, I will be seeing patients just like you, coming into my clinic today and saying, I needed a consultation with a pulmonologist, and simply all I'm going to be doing is probably for the majority of them clarifying their inhaler use. And it starts there because your foundation is there. You don't want your doctors escalating care before you've done the basics. And some people say, well, there's biologics. Yes, there is biologics. That's an injection though. For the most part, you'll be giving yourself an injection, or you're going to be going somewhere and getting an injection to prevent something that you could have prevented with the inhalers if you optimize them. So I want to let you know, if you're meeting me for the first time, that yes, I'm going to be the one who is going to stop you in your tracks when you're thinking the answer is to go see the pulmonologist before you do the asthma care, basic care, that you're making a mistake because you didn't really give that basic care a chance and you didn't do a good job with it. Majority of you, when I meet you, have not even figured out what you're supposed to do with your inhalers. Or you think you know about your inhalers, but you don't. When I put you on the spot and I say, show me, you're all of a sudden, distressed or upset because I asked you to show me something basic that you've been using for God knows how long. Are using these inhalers for the first time. They are confused and they're easier to fix. But the people who are using it for years, and then I come and I say, show me, they get so disappointed. Like, I didn't come see a pulmonologist for them to show me inhalers, but guess what? Those people, if you're referred to a pulmonologist, it probably means your asthma isn't well. If you're going to the ER frequently, your asthma isn't good. If you keep waking up at night with your asthma flare-ups, your asthma isn't good. So you have to first accept that, hey, yes, I may have these inhalers and maybe I'm not using them properly, and begin from scratch. humor me and look at those videos, because if you're not improving in how long you hold that breath with the medication, you're improving in how you apply it, which is why I am always emphasizing, if you have an inhaler, identify whether the inhaler is a emergency device, meaning you're only using it every so often for these breakthrough symptoms, or is it your maintenance device? And if it's a maintenance device, did you find out whether you're supposed to be using it once a day and or it was twice a day? Your doctor knows the difference. If they wrote twice a day and you're doing it once a day, guess what? You're not getting a full effect. And your doctor may not ever figure that out, because they're going to assume you couldn't possibly be doing it in any other way other than the way it was prescribed, right? So there we go. Then you get to see someone for the injections before you even did the basics, right? Or you have to add injections or add pills, or keep having to bail you out of a flare that never ends or keeps coming back to bite you over and over again. And you keep going to the ER multiple times, getting the kitchen sink each time you get sick, seeing a provider unnecessarily because you did not get the basics. And I'm here for that. That's why I'm here, because I see it so often. And every time someone gets admitted, someone is in the ER, somebody is hospitalized, it's a lot of money. Why did you come in? You go back and you backtrack these patients that are honest. They're not using the inhalers. They're not using them properly. When I tell them, where's your inhaler? It's at home, even though they came to the ER, they didn't bring it in with them. That's another point where I could check on their inhalers. Then they get discharged. Before they get discharged, they never brought the inhaler in so we could check it. You want somebody to check it, and you can do it all by yourself. I think it's important that you go back and take a look at some of the videos where I'm showing you how you should be doing it. And if you're doing it any other way, then fine. If your inhaler is doing you justice, but don't be surprised that you could be on a very high dose because somebody thought, maybe let's go higher, maybe let's add more inhalers, maybe let's get this one and that one. But they never figured out that even if you do higher and you never got the technique, that you may potentially be not getting any medications whatsoever, because the inhaler was put in and then exhaled out. And that doesn't make sense, right? Because it needs to go in and you need to hold that breath. You need to count to 10. You really need to do that. Don't be quick and fast and skip that step, because then you're not gonna be able to compound your effect of your asthma, control, or COPD. And yes, they're very different. Asthma and COPD are very different, but when we treat them, they're very similar. So we're gonna talk about them as if they're very similar. If you're smoking, of course, if you're vaping, of course, you should not do any of those things when your lungs are still trying to settle themselves and they're already struggling to breathe. You're not doing yourself justice. And if you haven't been able to quit, then you want to make that a priority as well. As long as you're taking your inhalers, you're doing your part that you can do at the moment, but make sure you pursue cessation of smoking and vaping, because that cannot help your lung either. So as we meet and as we cross paths here and there, as you go through the page and see what I've been teaching maybe about 3 years now, mostly on TikTok. I'm on YouTube lately because I have really neglected the YouTube, and I want to make sure that you guys are getting that chance to get the educational component, which I can't really do on TikTok because TikTok is so fast. But definitely the library of teaching your inhaler is possibly already displayed on TikTok, or maybe now we have the silent series where I'm showing all the inhalers that I have in my possession. I'm showing you how to use them pretty much on a silent mode and with music in the background, whichever one you like. But take the time to understand what I'm trying to tell you. And on the bottom of the links of every video of mine, I'm always giving you tips. I'm always telling you, please rinse your mouth, gargle your mouth after certain inhalers. And if you're confused which ones, gargle after all, because otherwise you get throat thrush, and then you're seeing a doctor for the thrush and you don't understand why you had to see the doctor for the thrush, and you repeat it over and over again, and it could be simply your inhalers were not rinsed out properly. So I want to let you guys know that if you are beginning to understand your inhalers, then the next step would be, how do you know you're getting into a flare, and what can you do at home today or tomorrow or in the future about that flare, and how you could prevent it, at least attempt to prevent it. The first thing I would do, obviously, you'd reach out to your doctor and say, hey, I'm coming down with a flare up. That way they can get ready to start treatment. Some doctors feel very comfortable sending over steroid pills or nebulizer therapies or antibiotics, depending on what you tell them about your flare. But the clues that we would want you to know is that you're using that rescue inhaler frequently. That's a clue something isn't right. I have to tell you, that is probably the first clue. You reach out for your rescue, you should be asking yourself, is this going to be a one-time thing, or is this going to be repeated? If you repeat it a few times, then maybe you should reach out to your doctor and ask for them to send you some sort of treatment to try to get that asthma or COPD settled. Of course, they should do a chest x-ray. I think it's important because some of you, this is a flare that is a hint to other processes such as pneumonia, and congestion, CHF, which is congestive heart failure. There are other things that cross path in anybody's lungs that we don't want to neglect. So getting that chest x-ray also held as part of your care when you show up to your primary doctor. Don't neglect it, or your providers. Majority of you will be seeing your providers in the clinic. Some of you guys will be seeing your providers on a phone. And believe me, a telehealth visit is not the same as a in-office visit. And we should not neglect that if we tried something and it doesn't get better, that you would link up with the provider again and see what is missing. When you start your nebulizer, when you notice that your lungs are not right, start your nebulizers. Am I prescribing you a treatment plan? No, I'm telling you that if you have a nebulizer at home, then maybe you should put it out and start using it at the schedule that you're prescribed. I often give my frequent flyers, the people who keep having flares, beyond checking what they're doing with their inhalers and their regimen is straight, that their schedule is straight, their technique is straight, and they're consistent every single day on a maintenance. When they flare, those people who keep flaring multiple times, I prescribe them a nebulizer. I give them a nebulizer, and there's videos how to use that. But you need to have one at home. If you constantly flare, or if you hit the ER one time, or you hit the urgent care one time, or you schedule an unscheduled visit with your provider for asthma flare-up, you should consider having a nebulizer prescribed, because within the nebulizer, when you're short of breath, you can't take that deep breath. You're not able to hold that breath. You're not able to synchronize that proper technique. Then you're going to have to ask your provider to give you a nebulizer, so that way you have a mask on and you're taking a mist. You're taking a shallow breath and you're taking a mist of the same medication we potentially have in your inhaler, but now in a nebulizer format. And then they can call in an x-ray for you. If they are with you, they will order one, and they can ask you other reasons that this could be happening. You could have a sinus infection, you could have congestion. They could look at your legs and see if there's swelling in your legs, and maybe you have congestion on top of everything. They're unrelated, but they can coexist. Maybe you're developing into a pneumonia. Maybe you have an infection that is brewing for a long time, that they've treated you over and over again and you didn't get better. It keeps coming back into a flare, into pneumonia. Then they should consider checking that sputum and sampling it and seeing what exactly is growing on the sputum. I do want to hint, if you are an asthmatic or you are a COPD and you turn out to have a congestion phlegm all the time despite being on treatment, that's another clue. You may not be using your inhaler properly. You may not be using it on the schedule that is prescribed. You may have already maybe caused a chronic infection to brew in your lungs because the bacteria is in your lungs trying to capture the phlegm that you have. That phlegm is what we say, you have mucus, and somebody will say, oh no, I've always had mucus. You shouldn't really have mucus. I don't have mucus. Why do you have mucus? Because I'm asthmatic and because I have COPD. Did your doctor optimize the care so that you do not have sputum and failed? And if so, did they check what's brewing inside your sputum? Because something is creating that phlegm, either the uncontrolled disease from the asthma, the COPD, or whatever else you may have, or you're not taking care of your asthma that it is actually brewing that phlegm on a consistent basis, or your COPD. So it's very important, because if phlegm lingers in your lungs, don't be surprised the bacteria feels that's a comfortable spot to be. You are constantly supplying food, and therefore it is comfortable growing in your lungs and inviting their friends and family members to come enjoy the phlegm that you create and you keep. So it's very, very important that you understand. It's very, very, very important that you understand the difference of what you're doing to make your asthma worse versus what has already happened, and now you're trying to still get your asthma to do much better than it has. And what makes your asthma better controlled is what keeps you out of the hospital. It keeps the pneumonias and the diagnosis for pneumonia or propensity to get pneumonia lower, the visits to the doctors and the consultants and etc. less, because your asthma is controlled. You won't wake up at night and need a rescue inhaler. You won't wake up at night, need a nebulizer. If you do these things, these are flags that your lungs are not good. I don't care what you think. Your asthma is not good if you're waking up at night. It's actually waking you up. It means it's not controlled. So again, my name is Dr. Mkono. I'm not going to have the time today to go over inhalers, but I would advise you, if you're watching this video, that you would take a look at some of my lives, because I have gone over all the inhalers in some lives that are popular, their technique. And I want to remind you on your review of these videos that you actually include the prescription you were given. Go back and take a look. Did they say twice a day and you're using it once a day? Because if you do that, it's not gonna work for you. Inhalers don't work as you think. They need to build. The rescue inhalers are separate. Let's put those to the side. But the ones that somebody said, use this inhaler twice a day, and you happen to say, well, I only need it once a day. Don't do that. Because if we're going to cut down the dose, we may cut down the dose within the device and make it a smaller dose. We don't cut down the frequency like that. Some inhalers are once a day. Therefore, day 1, it will be 10%. Day 2 will be 20% effect. Then 30, then 40, then 50, then 60, then 70, then 80, then 90, then 100% effect after 10 days, right? And then if you decide, oh, I'm going to just use it once a day because this doctor doesn't know this is expensive, so I'm only going to use it once a day. Well, more expensive would be visiting that doctor in the ER, urgent care, interruptions, and you can't go to work. That to me is more expensive. Therefore, understanding how to cut that dose down is important. You making something that is supposed to be dosed daily to a sporadic when I need it is changing the prescription without really consenting with that doctor, and yet go back to that doctor and say it's not working. You need to say, well, first I need to go back with what they told me to take. They said take this inhaler once a day. You need to open it up, make sure you take a full breath of it, keep it down, count to 10, and then do it again once a day, the next day, and then again the next day. That way it's building and compounding and giving you the full effect. If you do it once today, you get 10%, tomorrow 0, so tomorrow will be 0, and the next day would be 0, and the next day would be 0. And then when you get sick, your lungs are not protected, therefore they flare really high very fast, right? But if you use it every day, your lungs, if they were all irritated, will come down to earth and they will be calmer, just like my lungs or somebody who doesn't have any asthma are on a good day. Versus if they're not controlled, they're wheezing, they're hacking, you feel like they're working against you, and then you get sick. So your lungs are up here, and then you get sick, and you go up to the sky, and you have pneumonia, you get sick, you have to see the doctor, you're very annoyed, you're not getting better. You don't tell the doctor, I'm not using my medication as prescribed, do you? Most of the time you don't, and they don't ask you, because they're just gonna get you through that moment of your flare. So flare come in multiple waves. It could be because you didn't use your inhaler properly. Majority of you, I have to say that's where it lies. And then it compounds with the fact that your lungs are irritated on a good day, then they should be calm. And now you get sick, which then exaggerates the irritation. And the other thing is making sure that if it's been dosed and prescribed by a doctor, and you feel like, okay, I got relief, but not all the way, you follow up with that doctor so that they can get a chance to add, increase, dose, change. Maybe it was 50 micrograms, now they want to use 30 micrograms or 40 or 500 micrograms of that dose. It could be the same device, but inside of it, the dosing could be small, or it could be medium, or it could be higher. So therefore, if you got a relief or partial relief with a small inhaler dose, maybe that doctor needs to increase it a little bit. Maybe that will give you guys control, or maybe it won't give you control. They can check your breathing test and fine tune your needs. But it's very important you realize that inhalers are such mild forms of treatment, and they only work if you are applying them, especially the maintenance, on a consistent basis. The rescue is a separate thing. That is what we use on top of your maintenance inhaler to help you with those periods where you have breakthrough symptoms. So again, my name is Dr. Mkono, and I just want to let you guys know that I am here. I'm reading your comments. I'm listening to what you're writing, what you're telling me. I'm not your doctor, but I do give you advice that tells you what to do, at least for that moment, and while you're waiting to link up with your provider and see what next they can do. Staying at home, letting it brew will only make it worse. You'll probably end up staying home for a few days and staying in the hospital for longer. So making sure that somebody is attending to your concerns is very important. The sooner, the better. Again, my name is Dr. Mkono, and I hope we see each other maybe on the next live. And if you have questions, make sure you let me know. Be patient with me responding, and just make sure that you link in with your providers as well, and make sure they are also aware of what your treatment plan is. And if you're not on any treatment plan, be honest with them when you see them. So that way they can talk to you about the pros and cons of pursuing treatment for asthma or COPD, or maybe work you up for asthma or COPD. I wish you all the best. Again, this is Dr. Mkono. Nice to see you. Take care.